So with that, I'd like to invite Professor Nikki Mulder to the stage, who heads the Computational Biology Division at University of Cape Town, who's going to lead us through a panel discussion exploring many of the themes that our speakers have presented. So over to you, Nikki.
Okay, so we've heard some great talks there about the importance of infrastructure. We know that anybody who wants to do pathogen surveillance has to have that bioinformatics infrastructure. What we want to explore here is how we make sure that the infrastructure has got to be fit for purpose for that institution, but we also need to make sure that it enables global collaboration and equity. And when you think about computational infrastructure, there's the pipelines, but there's also the data, there's the movement of the data, there's the security of the data, the metadata, all of these things that we've heard about over the last day or so. And we need to make sure that there's equity in this. We need to make sure that there is access, that there's capacity. So underlying all of this are people. So these things don't work on their own. We need the skills. And people often underestimate the IT and sysadmin skills required to actually set this infrastructure up in the first place. So we're hopefully going to unpack some of this, including a bit about sustainability and resilience of these infrastructures. So I'd like to invite to the panel, to the stage, my panel. So we have, and you can just come up, you know who you are. We have Torsten, Seemann, we have Tulio, Campos, we have Karin, Lagesen, and we have, I know I'm going to get the name, I'm going to mispronounce your name, Aine? Aine, okay. So, and then we have Stephen. So I'll introduce them when they are up on the stage. Okay, so Torsten is an associate professor and head of bioinformatics at the Centre for Pathogen Genomics in Melbourne. So he's an internationally recognized bioinformatician specializing in microbial genomics and tool development. He has thousands of citations from his tools and also developed the Oz Tracker, which we've just heard about. Tulio Campos is the coordinator of a bioinformatics core facility at FioCruz. So he leads efforts to advance bioinformatics and AI applications in health and biomedical research. And he's been developing bioinformatics solutions for public health while fostering collaboration across scientific communities. Aine is, sorry, I get that right again. Is a senior researcher at the University of Edinburgh studying viral evolution and building tools for genomic epidemiology. She's PI of the Arctic Network, leading development of resources for viral outbreak analysis such as pangolin and squirrel. And she served as the chair of the pangolin lineage committee and worked in phylogenetics core of the UK COVID-19 Genomics Consortium, among others. Okay, and then we have Stephen Kanyerezi, who is a bioinformatician at the Central Public Health Laboratories in Uganda. So he leads national efforts in pathogen genomics, outbreak response, bioinformatics infrastructure development, and spearheads the implementation and localization of NGS workflows for HIV, Mpox, among others. So, and then our last panelist is Karin Lagesen, who you've heard from already. She's the team lead for bioinformatics at the Norwegian Veterinary Institute, and we've heard all about your work. Okay, so we're going to ask them a few questions, and then we'll open up to the audience. Okay, so I think I'm going to come and join you down there.
Have a seat, Nikki.
I will. This works. Okay, so let's start with Torsten. So we know that we've heard from these different speakers this morning that we've got to think about what are the right tools that we want to, Torsten, yeah, it's for you. So we've got to think about the right tools in terms of, what is the right, everybody's developing tools around the world. What is the, how do you make evidence-based decisions about the tool that you're going to use? Maybe you can describe how you do that.
Thanks. Is this working? Yep. Thanks, Nikki. Yeah. Look, software is hard. I think many of the bioinformaticians here recognise that. We've heard some good introductions from Peter and Karin talking about things like, well, first there's like, a workflow language. There's like multiple workflow languages. Which one do we choose? Then you've got to think of what do I have to run it on? Am I running it on my local laptop? Am I running it on a server that Peter gets asked, what server do I buy? Do I run it in the cloud, or do I just use some commercial software? then there's the next question, what does it have to run on? Is it going to be an Intel CPU? Is it a new ARM CPU, or is it something new in the cloud? Like, there's all these variables which kind of constrain what software you can run. So there is a lot of software out there, but not all of it can run in every situation, every piece of hardware that you have. So you are constrained on your choices. It's not a totally free decision process. And then it's meant to be all solved by containers. Or Bioconda, but even that, it's complicated. So every step of the way, you're sort of constrained on what you can do. And I guess when I started out, it was a big focus on the individual tools. So you've got to achieve some goal. What tool do you use? How do you evaluate it? Well, usually you sort of just try every tool and try and see, does it do what you want? Like, that's the simple answer. But that's sort of not really feasible for everybody to do. So I guess the question is more about a public health setting, a surveillance setting, which is quite different from a research setting or another project. So what's the big constraint there? A public health lab, ideally they have something that's sort of accredited or reproducible, it's going to be stable, so they have to think hard about what is the actual question they want. And there is no answer about what is the best software. There's a lot of good software out there, but it may not be fit for purpose. It may not answer what you want to do. So really, when it comes down to it, you have to do the evaluation, and you have to do that in a systematic way, some kind of benchmarking process. You have to think about what question does this public health assay need to answer? If it's about AMR detection, if you need to make sure you can detect all the known AMR genes, then you have to design a benchmarking process which tests the ability to recover all those AMR genes. If you want to do clustering, you need some kind of benchmarking to do that. And one way to do that, say for phylogenetic clustering, maybe you have historical outbreaks where you have epidemiological information and decisions made about what were clusters, and you use your software clustering technique to validate what you've done. But I think also what we can do in bioinformatics that isn't typically normally done in other sort of validation processes is we can generate lots of synthetic data where we know the ground truth. So you can design a large, extensive set of benchmarks where you know the answer, you can test the software and then evaluate its precision and accuracy relative to what you want to answer. So yeah, there is no one best tool. You do need to I guess there are some best practices, and you will talk to your colleagues in other labs and through the communities we're building through PHA4GE and IPSN. The quality software does sort of rise to the top. The word does spread, and you can see from their GitHub or their how often it's used, how many questions are being asked, are bugs being fixed, because longevity is also another factor you need to keep in mind. There might be this new shiny tool which looks great, but it won't be looked after in 1 year's time. So. Yeah, and I guess at the Public Health Lab in Melbourne, we have done a lot of this benchmarking, and we have accredited to ISO standards we have local accredited, but ISO standards we have an AMR tool and a TB AMR tool, and yeah, that was a lot of work. But it was a mixture of using historical lab data, using synthetic data, combining that into a benchmark, and then running those tools, and then writing the process down. So yeah, I'll stop there. So that's, thank you.
Complicated process.
It is.
And it's important that I think other people also get to benefit from the benchmarking that's been done, because to avoid everybody doing the same thing again. I think that's where the PHA4GE working groups can also come in to help.
The PHA4GE working group does do that, and also for these two accredited tools that I've mentioned, all our benchmarking data is available, open source, so you can, although you can't just use the tool and it's accredited for you, because accreditation is a per laboratory thing, we have provided all the data there for you to reuse for your own accreditation process. So I think that is the future of this, is that we do have to share our protocols and our benchmarking data so that we don't have to repeat this over and over again.
Yeah. Okay, so my next question is to Tulio. So tool selection is all very well, but you need to think about the quality, and maintaining quality. So can you maybe tell us about how you are doing this quality assessment in FioCruz and your national surveillance system?
Yeah, so thanks for your question, Nikki. Yeah. First of all, it's a pleasure to be here today at this joint event between IPSN and PHA4GE. It's my first time in Africa, so I'm very excited about that. It's been very enjoyable, and particularly to discuss these important aspects in bioinformatics applied to public health. So yeah, as you said, Nikki, the tool choice is important, but in the context of genomic surveillance, it's also important to take into consideration the quality assurance of the entire process. And has been really critical to the work that we've been doing at FioCruz. Just to give you all a bit of context, FioCruz is the largest and most important public health research, development, and capacity building institution under the Ministry of Health in Brazil. And during the COVID-19 pandemic, FioCruz played a critical role in developing and producing diagnostics and vaccines, but also in employing genomic surveillance. And nationally, and this complements the important work in molecular diagnostics that's employed by the state laboratories across the country. And it was in this context that we built and maintain a database and a data management system to process all the genomic data generated by this network. And we extended our integrated approach for the surveillance of other viruses. For example, we had recently an outbreak of Oropouche virus, and we reported really quickly by providing critical genomic information and analysis for public health authorities, as well as scientific outcomes linked to the surveillance of this virus. So across our network, we have genomics expert groups located at different states, and we collaborate, and they generate vast amounts of genomic data. And the challenge, but also the opportunities to translate these raw reads into high confidence information that supports public health decisions. And that's exactly where the bioinformatics quality assurance that we employed becomes really essential. So the approach that we took is to embed the quality assurance principles at every step of the data lifecycle, from the moment the sequences are produced in the regional labs to the analytical results that are reported back to the Ministry of Health and to the state governments. So, and we structured that in 5 axes. So first is standardization and benchmarking, as mentioned by Torsten. We developed workflow that were validated in internal workflows, internal benchmarking exercise, and compared different tools, parameter settings for the critical tasks like trimming, alignments, variant calling, lineage assignment, submission to public databases, and all in an automated fashion. And all of that for streamlining all the process to reduce the time between the sample collection and the reporting. That was our main goal, and with high standards. And these benchmarks, they provide not only the accuracy that we need but to evaluate, but also the guidance for the reproducibility, which is an important aspect as well. And we maintain these protocols and the software and version-controlled repositories like GitHub, GitLab, etc. Second is auditing and data traceability. So every sequencing run on our service is subject to metadata validation, similar to Ostraka. And we keep audit trails as well through our workflow management systems, so that every sample and the intermediate files that can be traced back to the processing environment. And this is important as we need to confirm or correct reported results in collaboration with the different labs. The third aspect is we implemented continuous monitoring and performance evaluation. So our network generates routine quality check reports that track metadata completeness, check genome coverage depth, and we keep following that, check contamination rates, and analysis success for the different sites. And these dashboards make it possible to detect early signs of systemic issues. That's what we also need to check that. For example, decline in read quality, contamination, or other technical issues along the way. And because these laboratories of FioCruz are distributed nationwide, the real-time monitoring helps maintain coherence and also the standardization across the network. And the idea is to integrate feedback directly into the production pipelines. So quality control is part of the workflow, direct part of the workflow, not just a separate activity. The first aspect is about training and governance. To sustain that, we need people to understand the process and the logic behind everything. With the teams, different teams, diverse teams. And so we built a training structure as well within the FioCruz Genomics networks to share operating procedures, standard operating procedures, quality criteria, and also troubleshooting. And in our internal governance, we have teams that are composed of bioinformaticians, sequencing specialists, and public health experts that meet regularly to discuss the different aspects. And the final aspect I'd like to emphasize is the translational aspect in public health. So the translation from these technical quality indicators into information that's useful for the health managers. So the bioinformatics quality assurance is not an end in itself. The purpose is to ensure that when a genomic result reaches an epidemiologist or a policymaker, it carries a confidence level. And that kind of transparent reporting also bridges the gap between the sequencing platform and the health decision maker. And ultimately, the quality assurance in our network to be trusted by the ministries, laboratories, and the public to then, as an ultimate goal, to transform data into evidence.
Thank you. So really incorporating into every single step, which is important because you're making decisions on these. Thank you. Aine, so from your experience with the COG UK and Arctic Network, so what are the biggest challenges you think there are in maintaining bioinformatics capacity at scale, and how could one connect these global, local, and national systems?
Yeah, so I suppose for those that aren't familiar with how the COG UK setup was run, we had a kind of centralized server, Climb, that kind of all of the kind of independent partners, many labs were submitting their data to regularly. And then the kind of big, complicated, kind of memory-intensive analysis was run centrally. And then the kind of end products and the things that people could then use to answer their own individual questions was made available. And so this was kind of maintained on a regular basis. So I think the sort of challenges with that was ensuring that the end products and the kind of analysis that were run actually were fit for purpose, and they were the pieces of information that all of the partners did actually need to then go on and answer their questions. So communication on that end was really important. I also think that when you're talking about maintaining this, you know, in terms of like staffing and redundancy, I think from my perspective during the pandemic, there was often just a single person responsible for a thing, and if they got sick or went on leave or whatever, you know, this was kind of a vulnerability in the whole system, and you don't want your public health infrastructure to be based on that, right? So I think redundancy in roles and the ability to kind of replace that, I think, is really important. And that also kind of leads into staff retention, and you know, people move around. You can have your bioinformatics capacity in place. You can have people trained up. You can have, you know, put all of the time and effort into kind of having this system in place. But people move around, so you know, if someone leaves, you need to have the documentation. You need to have the materials that makes it easy for someone else to learn and pick up and continue on that setup. So in terms of maintaining infrastructure, I think that's really, really important.
Yeah, I mean, the infrastructure is all very well and keeping up to date with the software, but it's the people, as I said earlier, that, you know, and as you alluded to, and if you're relying on a single person, because not everybody has a luxury of a backup. So you're absolutely right. So Stephen, Uganda recently leveraged the investments in genomic surveillance to deal with things like the monkeypox outbreak. How have you approached building sustainable bioinformatics infrastructure that's sort of fit for purpose and can meet the national needs?
Yes, thank you, Nikki. Yeah, so as we shall all agree, yeah, our genomics lab is really very young, and we have rapidly evolved. And this rapid evolution has been fueled by, partly by the recent outbreaks, that's Mpox, Ebola, and other pathogens of public health importance. And during our journey, we have been looking at building an end-to-end system that is from sample collection, sequencing, bioinformatics, and reporting. And we are currently we are around 4 years old, but what we have done is really beyond what a 4-year-old genomics laboratory can do. Currently, we started with like 2 sequencing platforms, but as I speak right now, we are around 7 sequencing platforms, and these range from, and these have different throughput from low to high. We have the NIS6, MY6, I6, and as well as the nanopore sequencing platforms. And as we are growing, some of these have been decommissioned to other supporting labs, partnering labs like JCRC, the Joint Clinical Research Center. Yes, so while doing this, we are not only looking at capacity building, but rather integration of genomics in national systems. So genomics is not being run as a parallel activity, but rather being incorporated into the national systems. And when we look at our sustainability plan, it rests on 3 pillars. 1, localizing and developing open source tools. I think one of which we have already published, the HIV drives, HIV drug resistance identification, variant evaluation, and surveillance pipeline, and many others that are still just within the lab. They are co-hosted within on our servers. Yes, and secondly, we are looking at training different personnel who blend in with different skills, that is wet lab, data, and bioinformatics. And lastly, we are looking at embedding our bioinformatics within national systems. So with all this, we are building a system. We are looking at continuity rather than individual-based success. In addition, with our infrastructure, it is a hybrid one. With hybrid, we are looking at both local and cloud-based. And with local, it brings in our partnerships and collaborations. And these collaborations span from local to international. And locally, I think we have made use of, an example is the African Center of Excellence in Bioinformatics and Data Intensive Sciences. And also, rather, the HPSAD, the African Center of Excellence in Bioinformatics and Data Intensive Sciences. And also we partner with UVRI, the Uganda Virus Research Institute. Yes. So then with the cloud-based platforms, we have been able to make use of the Terra platform, as well as the Galaxy platforms. Then with the so with the running of this analysis, so it depends on which analysis is best suited for which platform. If it is local, yes, we go with that. If it is cloud-based, then we go with that. In most cases, we ever leverage the cloud-based platforms whenever we cannot use our local platforms. Then when we talk about sustainability, sustainability ceases to exist in the absence of collaboration. And Uganda has benefited from these collaborations. They are both local and international. And locally, rather, we have also benefited from the different fundings. Just to mention a few, the Africa CDC's Pathogen Genomics Initiative. We have also benefited from the World Health Organization, the Global Fund, and also from networks like what we are having right now, the PHA4GE, yes, Pathoplexus, then also our local partners, that is some of which I've earlier mentioned, the Uganda Virus Research Institute, the academic institutes such as the African Center of Excellence in Bioinformatics and Data Intensive Sciences, research, that is a Joint Clinical Research Center, as well as the IDRC, which is the Infectious Disease Research Collaboration. Yes, so with all these partnerships and collaborations, we have benefited from joint tool developments, trainings. Yes, and with these trainings, we are also, not only are we benefiting, but we are also transferring this to other institutions that benefit these. And these institutions are both local and international. Starting from the local, I can say at this point, like I will ever record the years we have been in this space, 4 years. But at this point, we are able to also train people who are doing diploma in genomics. This further shows that by the time they reach at these other higher levels, they will know what genomics is, what bioinformatics is, and that is very important in building capacity and sustainability. So internationally, we have also offered support. Sometimes we get other trainees from other countries, and this spanned a different range of countries. But just to mention but a few, Malawi, Burundi, Rwanda, Kenya, Tanzania, Ethiopia, and Zambia. So sometimes we host, and also sometimes we are hosted within their institutions. And in addition, we also take in the hybrid format where we support remotely. And not only do we support, but we are also supported. Sometimes I think one of the major one where we can also all remember, where we had our near to real-time release of the complete genome of Ebola virus, where we had a collaboration and partnership with the SANBI, the South African National Bioinformatics Institute. And beyond that, we were also, I think, supported by the Broad Institute. Yeah. So all these are essential to produce a continuity within genomics. Then further, our long-term plan is national ownership. With national ownership, we are looking at having this genomics within the government laboratory frameworks. So that, as I'm speaking right now, we are in our final stages of completing the national genomics surveillance plan, and this encompasses different stakeholders, that is from academia, environment stakeholders, and also research institutions. Yes, so with this, we are looking at shifting genomics from just a donor public health experiment to rather something that can be owned by the nation, and this will further facilitate faster decision makings and also reporting. And finally, I should say this should be the main point, much as it is coming in last. So all this cannot happen without the right leadership. So the leadership has been crucial to all this. Yes, thank you.
Thanks. So several key messages there. I think that, okay, there's nothing like an emergency to get things going fast. We know that during COVID, everything was fast-tracked. So, it probably helped to get you this far in 4 years that you had these outbreaks to deal with. But also, I think the collaboration that you're talking about, both with academic institutes in your own country, but also these different networks, I think obviously had a large impact, and of course the diversity in funding and the governments and the leadership, so many key messages there. Thank you. So, Karin, so we've just heard about a lot of your work and how you're trying to make this accessible to different people. So when you design the infrastructure and the tools to enable insights to be gathered from public health data, how do you do that knowing that you have to not make it too technically complicated, and what are the additional challenges when you're trying to do this in the One Health setting?
Well, one of the biggest things to remember here is to go actually all the way to the end of the chain that your data is actually traveling, and start out there. Several have mentioned the concept of fit for purpose already on this stage, and this comes in here. A big thing is that you need to figure out, is the analysis you're planning, is it actually going to answer the question? And the biggest thing to remember then is not just is it going to produce the results you think you need, but will the results be able to trigger any actions? And you have to look at the actions. Does the results actually help motivate and sort out what you need to be doing? Another aspect is that the actions that you might be looking at might be under rules and regulations that you might have to bake into what you do and how you do things. I mentioned the human side earlier today having issues with GDPR and personal information and being able to share data. One of the things that have influenced our structure is the fact that we are dealing with a lot of data from food producers, which have economic interests. So in our laboratory information management systems, we have this magical term called purpose that is attached to every single sample we have. And we have to be mindful about the purpose that a sample has been gathered under, because that can have huge impacts on what we're allowed to do. A simple example, we do get some commercial analysis of listeria from fish companies, and we have to be extremely careful to not mix that data with the public monitoring listeria data that we get from the food authorities, because then we could accidentally have incidental findings, which we would sit there and what do we do? And when it comes to listeria, Norway is one of the largest aquaculture producers of salmon in the world, so this is not a tiny concern. So you do have to go all the way, not to the results, but to the actions that the results could help inform, and then trace everything back from there, and it'll influence what analysis you build, and what tools you use, how you put together your data sets for the analysis, and also then all the way back to how do you put up your infrastructure, which tools do you make available for the people who are going to do the analysis. A simple example here, I have to make sure that we're operating with project buckets with strict access. So to make sure that nobody accidentally mixes the commercial listeria with the public monitoring listeria. And we have that access control so that nobody can, by accident, do this. But it goes through all the way down to the bottom of how you put together your infrastructure, the access views that people have, the tools you use, the analysis. You have to start from the end and work backwards.
Thank you. So it's really, finding what it is, the ultimate goal, and then building accordingly. So this is a question for all, or whoever wants to answer this. What one action could accelerate equitable access to sustainable bioinformatics infrastructure globally? I think it's a difficult question, but does anybody want to start? I pick you. You want to start?
I didn't fully hear the question.
Okay, so if there was one action that you could think of that could accelerate equitable access to sustainable bioinformatics infrastructure globally, what would it be?
Well, that's a complicated question.
Yeah, it's kind of loaded.
Our centre does a lot of capacity building in the Asia-Pacific region, which unfortunately is not that well represented here, but there's a lot of parallels with the African situation. So we have such a wide variety of people. So places like Fiji are islands that have their internet undersea cables cut and have very poor internet. They don't have Starlink because there's no point putting a satellite above the Pacific, apparently. And then we have other countries where they're quite advanced, but there's just no bioinformatics capacity, and they have a local computer, but they can't use cloud services because the data's not allowed to leave sovereign borders. This is a big problem. A lot of the countries where we don't have cloud in their in-country cloud, so the cloud is not an option. So I guess we've been trying to, I guess the biggest thing that could be done is you could fund software. This is what I say, there's so many, we're all using the same tools. We want all the same things. We're doing all the same genotyping. We're doing all exactly the same things, but we're all kind of building our own pipelines for various reasons. I mean, building your own pipeline is a good training exercise, but I think there's a lot of wasted activity, and a lot of I do write a lot of tools, but it's coming from sort of research money. We're stealing from research money to support public health, and I think that's not great. It doesn't work for anybody. If there was some kind of funding system that could support the development of software, collaborative software building across all of us in this community, that would be something which I think would make a huge difference to solving these continual problems of getting stuff running. Because public health's not really about fiddling around with the details. We want the answers so we can, make actionable decisions. So yeah, if you could do that, that'd be great.
That would be fantastic. And then I think if that, to go a bit further, since everybody might have a different computing infrastructure, that one software can run on anything, because you need it to run on the hybrid solutions, on very specific on-prem solutions. So that would be the dream.
A good piece of software gives back 100-fold of the investment put into it.
Yeah, I'd just like to complement that. The beauty in the bioinformatics field that I'm really happy is because it's mostly open source. So that's in terms of the software. I think we, in public health and working as a community, that we can do a lot. We just now, I think, for public health is more validating, the different tools, having the proper benchmarking that's validated within the community. And for the things that are really already advanced. The thing that I still see the challenge is with the data sharing, but it's not data sharing, there's the data management and all that. It comes with the sovereignty of the countries. And then it comes, so infrastructure, for example, to build the infrastructure, to have the computing facilities, having IT managers and bioinformaticians that are locally, they are in those countries, and we need to train people. We need people in low resource settings to be able to own everything, from the infrastructure to the software, to the management, to the reporting, etc. And this because we can say, okay, you can just put on the cloud, then you don't need that infrastructure, but the human resources that do all that, the IT infrastructure, the bioinformatics, and all the analysis, these are critical skills worldwide. So even developed countries, sometimes suffer not having human resources to do certain things, but imagine in low resource settings. And so something that we've seen as well, it's people are trained in low resource settings and then they move to high resource, resource settings. And that's something that we need to find a way to overcome as well.
So I think kind of thinking about one simple thing you could get bioinformaticians to do, I think joining the Microbiome Slack, because it seems to be sort of a bastion of all bioinformatics knowledge, and from the ground up, I think it could really help. Just, it's an amazing community that already exists. So to just keep reinforcing that, and people new to the field, just encouraging them to join. I think it's one of those things that communicating, because oftentimes there is, especially in lower resource settings, you might just have one person, and having lines of communication and sources of knowledge open, I think is so important. Collins was describing yesterday in his talk about, in August we did a kind of workshop training where we got bioinformaticians from 23 different African nations together, and Stephen was there as well. And it was for MPOX specifically, but it was getting the data together, trying to just troubleshoot, ensuring people were running the right pipelines. When you put the data together, it's very clear to see, oh, actually, there's some issues here. This group's doing really well, and it was just so helpful. But one of those things is just making sure that those lines of communication are open, so that you're not just a single person in a single country trying to figure it out for yourself.
Yeah, excellent. That comes back to the collaboration and sharing skills and not feeling isolated. So we're going to open up to the audience shortly, but do you want to?
Yeah, so just add on to Aine's suggestion. So I think the other major thing would be, we are here in practice, but who feeds the practice? Who feeds the public health institutions? Those are the academic institutions. And I would further echo, I think, what Peter said during his presentation. This is a fast-moving field. Things are changing. However, as they are changing, is this change being incorporated into academic institutions? Yeah, so it is something we should also look at.
Yeah, absolutely. Thank you. Yep.
Just a short thought on this for me. One of the things that I think it's most important to communicate is that the stuff we're working on, the tooling, the infrastructure, it's not commodity software, it's not commodity tools, it's not commodity, well, some of the instruments are commodity, but still. And this means that it needs a lot more babysitting. And this means that we need funding and we need understanding from the stakeholders that you do need to mind the stuff to make it work. And also this concept that you do need to adapt it to the setting and the problems and where things are. I think I'm in the infrastructure working group, and I've heard weird stories about somebody wanting to fly in a NovaSeq into a tiny, teeny lab in Africa somewhere without internet connection. And it's like, that's not how you fix things. So you do need to figure out what actually will work on the ground.
No, for sure. So we have permission to take 5 minutes of your coffee break and finish at 11. So we have time to open for questions from the audience. Peter, can we have a microphone here?
So yeah, so I mean, Claire's presentation made me want to kind of contradict myself, because I said that we have a lot of open source pipelines, dashboards not so much, but it looked like amazing components there. So how can we share the visualizations, particularly the visualizations? Karin presented amazing, like, that's a database, we could all install that and use that for our viral data. So what are the, besides the pipelines, forget the pipelines, assume they're solved. What are the other components we could be sharing better, and how?
I guess we heard a lot about ontologies and stuff for storing, for describing some results, but what we don't really have is a schema for describing the outputs of the standard analyses that we do, genotyping, clustering, trees. What I envisage is that all these pipelines are doing whatever they want in their own way, but if their output was a machine-readable format, then that could be ingested by a visualization platform in a generic way. So it's this middleware of describing the outputs of our pipelines that I think we don't have. I think if you had that, that would go a long way to being able to reuse different dashboards. Just a simple thing, really.
All right, Peter, can add to that. Yeah, that's a very good point, because I don't see that either. Like we have built some visualization tools, and we'll be happy to share them. The thing with visualization is that the different regions or different laboratories may have different requirements for what they want to see. So that's one aspect. So we need to think about, like, maybe having a work group for data visualization. So then we can all learn and share the different ways of visualizing and to creating and sharing these the different tools. And the other aspects, like particularly with phylogenetics, with something that we haven't embedded yet, the thing with phylogenetics is that we find, for phylogenetics, we need to do a lot of curation before we actually, display something to actually make a decision. So we are very cautious about visualizing or displaying trees. So, but there are JavaScript, applets that you can, if you have a tree, you generate a tree, you can just put it there and you can visualize on the browser. The thing is, like, who is going to read that and who is going to interpret that? So we need to really think about these aspects before we just like, oh, this is a tool, just plug and play. This can be risky. So that's something that we need to consider.
Yeah, okay. Thank you, Peter. Yeah, so I think in addition, different institutions have different needs. So again, with the visualization, I think one problem is that. So you might find, for example, Torsten, they have different ways they would want their data to be visualized. So it becomes a challenge. Maybe something we should revisit maybe this is back to the developers, and something I think FioCruz has done is having that component when at the end of it all, they find different visualization options whereby, besides that, it can be further changed to fit into the institution's needs, because it is going to be very hard to have a standard way of visualizations. All of us are at different levels. For example, I would say back home, we already have a LIMS where things move. So our needs might be different from an organization that doesn't have that system already set up. Thank you.
Any other questions from the audience? Can't see behind the podium.
Over here.
Yeah, okay, go ahead.
Joel Savinsky. One of the themes of this conference, especially yesterday, was on the concept of data sharing, and we have to share data to have impact and have data standards and data formats. And then when we listen to the infrastructure conversation, there's a theme that percolates up of, we have to own, we have to have local, we have to own. And it seems counterintuitive that, on one area where we want to really share the data, but then on the infrastructure we want to own and each build up our own, for lack of a better term, silo. Any thoughts on that?
Great question. Anybody want to take that on?
Well, the first problem is for accreditation. In your own laboratory, you have to kind of have it on-prem in general. That's the first problem.
But can't you share what somebody else has done, and in terms of their experiences?
Yeah, and we do try to do that, but yeah, we're not doing it as well as we should. That's true.
Yeah, just complementing. So in the context of that's why there is this massive discussion on PABs, because the thing that happens, particularly with low resource settings, and this has happened quite often, is that we share data, and often we are scooped in terms of the research and the development of diagnostics and vaccines, for example, that are developed by developed countries, and then we have to pay or not having direct access or early access to these things. So that's why I think the PABs discussion and the implementation is really important, so people feel safe to share. The other aspect in terms of owning is not necessarily because of not just owning, is about how do we integrate this genomic information with the public health information, epidemiological, and all the data from the Ministry of Health, for example, to integrate that and to foster the environment, the internal environment in the countries to do research that links to the genomic data. And this is not easy to do just at a shared platform that has limited functionality in this aspect. So yeah, so these are things to discuss. It's just that sharing is important, but having a local infrastructure with their own data for that country is also important.
Yeah, well, just to add on to that, so when talk about ownership, I think we have different levels of ownership. And much as, yes, we are, back what we were saying that, yes, we need to own this, but rather to share the data. Again, that starts from the lab producing this data. So similar to the infrastructure, I would say it starts from the individual institutions having maybe some sort of low capacity storage, sort of low levels of infrastructure. Then at that point, that's when you see there is need to have maybe infrastructure that is shared. But before having an institutional-based infrastructure, there's no way you are going to think of the bigger game of having a shared one.
I think you could have regional sharing. You have the Africa CDC PGI network, you have the Asia PGI network. I think, you could start with regional sharing.
Could I just come in on that? So I think there is a perception of security as well. So you invest and you build up your bioinformatic capacity, and if you have a machine, you have something physical and it belongs to you. If you're talking about subscription models in the cloud, what happens if they stop, or you can't afford to pay the next subscription or something like that, or the grant runs out? I think actually investing in a solid piece of infrastructure, even if it's just a high-powered laptop, I think is really quite key and gives that sense of ownership and security for bioinformatics.
Absolutely. So, sorry to the audience, Is there one more question there? Okay, like super quick.
Okay, actually it's not a question, it's a suggestion regarding what actions could accelerate equitable bioinformatics access globally. One of the challenges bioinformatics people usually face is the barrier to entry. Most of the times people pick up bioinformatics at postgraduate level and they struggle. So my opinion would be if we could increase creation of bioinformatics courses starting from undergraduate, and there are not so many institutions in Africa that offer bioinformatics. So that would help. Then the other is how well do we teach bioinformatics? There is one site that usually intuitive to learn. With science, usually it can be complex. There is a site called Jove, G-O-V-E. It offers tutorials for methodology in video. I think if we could adopt this when we're developing tools, if you develop a tool and then there's documentation, which is usually web, but we could also have tutorials that can help a person to easily pick up the tool and apply to their pipeline. Then having cloud-based tools and also those that can operate on the command line can help us. So thank you.
Thank you. And we'll have a whole session on workforce development and skills later this afternoon. But thank you very much to our panelists and for an interesting discussion and your key insights. Collaboration, equity, skills, all these important things came out. So thanks once again.
And thank you to Nikki for chairing the panel as well. So I think it's been a really exciting morning, and I think I'm really taken with all of the innovation that's been articulated here, but also like this constant theme of institutionalization of the tools, these technical tools into public health. I think it's really encouraging to see everybody thinking about how to really embed this. I think the concept of modularization, I think, of tools and pipelines, I think, has come out across the piece as well. And I think, we could the conversation around data sovereignty, analytical sovereignty as part of this conversation, I think is key. I think we could have talked about that for another half an hour or so.